Mentally healthy workplaces protect and promote worker mental health and well-being by identifying and managing risks to psychological and physical health and safety. Factors in the design, systems, or management of work, known as work-related factors or psychosocial hazards, may increase the risk of work-related stress and lead to psychological or physical harm if left unmanaged. The cause of work-related stress can vary, and it's likely to be specific to workers, work, or workplaces. Some work groups may be more susceptible to work-related stress and harm from exposure to psychosocial hazards. When multiple related psychosocial hazards combine and act together, there is a greater risk to worker mental health and well-being. Identifying which psychosocial hazards impact negatively on a worker and taking action to control their impact is an obligation under the Occupational Health and Safety Act. Applying a risk management approach can help to eliminate or reduce work-related risks to mental health and well-being. A risk management approach to workplace mental health includes 4 steps. Step 1. Identify psychosocial hazards that might contribute to work-related stress. Unlike physical hazards, psychosocial hazards can be hard to spot. Identification of potential work-related psychosocial hazards might be achieved by observing interpersonal interactions, having one-on-one conversations with workers or running focus groups, using surveys to gather information, reviewing existing data sets like incident reports, workers' compensation claims, audit tools, and absenteeism reports. There may be psychosocial hazards that are unique to organizations or industries too. The second step in the risk management approach is to assess whether and to what extent identified work-related psychosocial hazards pose a risk to worker mental health and safety. Assessing the level of risk includes exploring circumstances, frequency and duration of the exposure to the hazard, likelihood of work-related stress occurring, and the urgency for action. Assessment of risk is completed when a risk assessment hasn't been completed before. There is limited knowledge about a psychosocial hazard or risk in the workplace. A new risk is identified. Something has been tried to control a risk and it hasn't worked. The third step in a risk management approach is to control risks to worker mental health and well-being. If a work-related psychosocial hazard poses a risk to worker mental health and well-being, measures need to be taken to control or eliminate the risk, so far as reasonably practicable. The aim is to implement controls that offer the highest level of protection and reliability for worker mental health and well-being. The final step in a risk management approach to mental health and well-being is reviewing and monitoring risk controls. Monitoring and reviewing ensure that psychosocial hazards are being effectively controlled and that controls are working as planned. Consultation with workers is an important part of a risk management approach to workplace mental health and well-being. Consultation helps to achieve better health and safety outcomes and allows workers to share first-hand knowledge of work-related factors that increase work-related stress. Engaging workers throughout the risk management process encourages them to be part of solutions and fulfills health and safety obligations. When workers are consulted, issues can be raised and valuable insights identified. Decision-making is shared and job control enhanced. Initiatives are more likely to be completed. Workplace systems can be improved. Mentally healthy workplaces protect and promote healthcare worker mental health and well-being and enable workers to do what they do best, provide exceptional patient care. Healthcare workers can thrive when work-related psychosocial hazards are proactively identified and actions taken to manage them.